From this morning. You know, I've been very blessed in that people will share what's going on in the community. And today, Melissa Sullivan, who is with Simpson General Hospital, is going to give us some information about safe haven baby boxes. Now, when they told me about it, I was like, that doesn't make any sense. But it makes a lot of sense. Tell us, and I'm so excited. Thank you for coming.
Yes,
Tell us about it.
Well, first of all, there's been a safe haven law for Mississippi for many, many years.
What is the safe haven
The
law?
safe haven law means that you can anonymously surrender an infant to a safe spot, which is decided between the legislator what that safe spot is. In Mississippi, it always has been hospitals, manned fire stations, or police stations, or an adoption agency that's manned 24/7. It's changed several times over the years. It was that you could surrender a baby up to 3 days old. Then it was 7 days old. And then this year, Caitlin Kelly has been kind of a forerunner and has solicited a lot of help. Angela Heal, Joey Fillingame, several others have helped with the legislation. And they passed a legislation this year that went into effect July 15, 2023, that a baby can be surrendered up to 45 days after birth. And not only can they go to a hospital ER or a fire station, they can now re-sign it into law saying that they can now use a baby box. Before this legislation, it wasn't eligible in the state of Mississippi because there had to be things with the Board of Aldermen and for each city and all that. So Tate Reeves signed something this year saying that any community in the state of Mississippi can now have a baby box in their community if they do the proper steps.
Well, you know, what is a baby box? When you say a baby box, I don't understand what you're talking about.
So a baby box is something that is installed into a wall. It has the size, oversized bassinet size. It has its own temperature control. There's air conditioner heating in there. It's temperature controlled at 75 degrees 24/7. There's a silent alarm, so if a mom decided that she wanted to anonymously surrender her baby over, we've always had that law, but really if you say anonymous, the way it was someone had to bring a baby.
It wasn't really anonymous.
So it really wasn't anonymous. And we know in the savvy world that we're in now, people text, they don't call, they don't make eye contact, And so we were seeing an increase of deaths for infants because they were abandoned in ditches and, all over the place. Even in Mississippi, we've had that happen.
And, you would think that wouldn't happen in
That's right. And then we don't even know about the ones we don't know about.
Oh, that's true.
So the baby box idea came from something like that, where it is totally anonymous. So a mom can come up to a location that has a baby box installed in a wall and open the door. It's a silent alarm. Place her baby into the bassinet. It also has another alarm that's a laser. And once the baby is laid in the bassinet, the laser is broken and another alarm goes off. In our case, the silent alarm will go off in the emergency room. So silent outside, but audible inside. Then someone will come to get the baby out and see about its needs as far as medical needs. The average time of a baby being in a box is 3 minutes.
Really?
So, and it has like a two-way door, so there's a door on the outside and then there's a flip-down door on the inside. It's a clear door. And it's already got the baby in the bassinet. The emergency room staff comes and receives the baby, attends to any of their health needs. Statistically, safe haven babies aren't really super sick. They're just not in a position where the parents can take care of them. And there's a whole host of, we can get into why that is. At the end of the day, it doesn't matter.
True.
If someone feels like their best option is to surrender a child so that at least it's safe, we'll take that every day versus someone abandoning one illegal. There are also consequences for that. So there are cases now where years and years ago when there wasn't DNA, babies were found abandoned dead. Well, now because of 23andMe and Ancestry.com, they are being and they're prosecuting those people even now. So if you abandon or mistreat a child, there are stiff consequences for that. This enables a parent who knows they don't have any other option, a safe thing, not only for themselves, but for the baby as well, and that's our main concern.
So why did you get so interested in this?
Well, I don't know why the Lord just put that on me many years ago.
I know you've always gone toward babies.
So when I graduated from respiratory school, I started out working in the NICU. I was 22 years old, not married, no children, And it first dawned on me when I had a patient that was 23 weeks that was born. Her name was Ebony, and she was born at the hospital. The hospital gave her that name because her mom came in, had the baby, abandoned the baby, and left. Well, it was at that time, it was the first time that I realized that not all parents care for their children. I just, had not ever realized. Yeah.
Never lost your time.
Well, it happens every single day, hundreds of times a day. Right? It happens all over the country every single day. It is a sad truth, but it is what happens. And so that just started a fire within me. When I became pregnant myself, after I got married, got pregnant, I just couldn't imagine and it wasn't so much, obviously I cared about the infant, but I also just worried about the mom. Like, how do you get into a situation where you think this is your best option? And so I just grew a passion and a compassion for them. And so the Lord, while I was pregnant, the Lord helped me write a grant. And we got a grant to start the Crisis Pregnancy Center. And then from that, it just birthed from there. And then, as I always say, the Lord writes the most beautiful stories. My husband and I and my 2 older children, as a family, we adopted a Safe Haven baby 4 years ago. And so Safe Haven became even more critical to me and something that I cared about. So it's just grown that. And then Mississippi's not really had a spokesperson for the Safe Haven. And so after we adopted our baby, I volunteered for the National Safe Haven Alliance, and so I've learned stuff from there, and it just keeps growing and growing. And then people like Caitlin Kelly that have started. She was the instigator in starting the baby box in Mississippi, and we have one now in Long Beach. It's the only one we have.
I was going to ask. So this will be the second.
This will be the second one, and prayerfully the first hospital in the state of Mississippi. So
that's awesome. Well, I think Simpson General's on the cutting edge anyway.
Well, I feel
aware of the needs of the people.
Yes.
It's what I think is so great. It's being aware of the needs of the people.
Well, and this is a community thing. It's not just a Simpson General, not just a Mendenhall. This is a Simpson County, even bigger out to the whole entire state, which is one of the reasons why I'm here for you today, is to let you know that so there's many steps that go into the Safe Haven box. There's many things that we have to do. And so we have gotten to where we have a contract. Now we have to fundraise. We do have to pay for our baby box. Our goal is $20,000. And the reason why it's $20,000 is it costs $13,000 to build the box.
I wondered. I was going to ask you because I know it couldn't be cheap.
Yes, right. $13,000 to build the box. Then we have to have a licensed contractor to install the box. Then there's some annual things to keep up the safety of the box. And so $20,000 is just kind of a round figure to cover our cost up for the first 5 years. And so the Safe Haven Baby Box Company is the person that we will buy that from. And we have a fundraising opportunity now that the Safe Haven has already created for us. We have our own link, we have a QR code, we have a mailing address, we have plenty of opportunities that you can give. They're 100% tax deductible. You can write off this as on your taxes, whatever gift, however small or big. So that is one plea that we have. We want to hurry up and do that because the sooner we buy the box, the sooner we can have it placed. And it takes about 3 months once we purchase the box. So we would love to have the box installed by January of 2024.
That'd be great. That would be great.
Yes. So we already know that there's 911 calls asking where the closest baby box is in the state of Mississippi.
Really?
So we know that there's an interest for these people that are in situations where this will affect them, and so we want to get them out. And there's several other cities that are working to get a baby box installed in their communities as well. So we hope we'll have, like Indiana has over 100 baby boxes in their state.
And that's well, we'll list on McGee News the link and the address and all that kind of thing, and so we'll have that available for you too. But I think that is wonderful. It's just a blessing that doesn't just keeps on giving.
Right.
I mean,
that's right.
You're giving, like you say, for the mother, for the child.
That's right.
For the family.
That's right.
Yeah.
And a lot of people say, well, what happens after this baby is dropped in the box? And I say dropped in the box, placed in the box. And they're quickly taken out. They receive care. They will be transferred to Batson, and Batson will make sure all the health is like that it should be. Once they are deemed medically clear to be sent home, they will go to a licensed foster care home, preferably one that is licensed to adopt, that is interested in adoption. Typically, a safe haven baby is adopted within 2 to 3 months. You don't have to go through the termination of parental rights and all the ups and downs that you do through the foster system if you want to adopt. But in this situation, if you get licensed to foster and have the licensing to also adopt, that you're eligible for a baby to be placed in your home. And if things work out like it's supposed to, they generally are adopted within the first 2 to 3 months.
Okay, saying that, how do you actually start? If I wanted to do that, what would be my first?
That is what we did when we adopted our baby. And the first thing you need to do is just go on the website, the Mississippi Department of Human Services website, fill out an application. Then someone will contact you and you will start the process. There's a host of interviews and background checks and all of those things. You'll have someone come to your house and check out your, those kind of things. And then you get placed on you decide what age range, if you can care for someone that might have a medical issue or whatever that case is. And then they will work with you with that, and then you go through that. Now, CPS will make sure that if they hear this, they'll say, I hope she says this. CPS is not an adoption agency. That is not what they are. But that is the nature of what happens sometimes. And so in these particular cases with the safe haven, the goal is to adopt in those situations because reunification is not the goal in a safe haven case. So they want to place it into a home that is licensed to adopt, that is initially a foster home as well.
How interesting. I just think that's fantastic. It's very, I hope we have good luck with our fundraising.
Yes,
because it sounds like a wonderful opportunity.
We're just under a fourth there, so we need some help, and the quicker the better. Our goal is to have 20,000 by October 15th.
You have got a tough go.
Yes.
About a month.
That's right.
About a month.
That's right. Yeah, we gotta get busy.
Thank you so much for coming, and we may be getting you back. Tell us a little bit more about how it's going.
I'd love to talk about anything related to this, so just call me anytime.
You really do. You have a heart.
I do. Yeah. Yes.
That's wonderful. I hope you'll have a good day, and again, we'll have all that information on beginnings.com. It is a wonderful opportunity, and I appreciate Simpson General Hospital and what they're doing, and stepping out and being the